right, go ahead and get started. Thank you all for being here for the weekly COVID-19 media briefing with District Health Officer Kevin Dick. It's just Kevin today, so he'll give a update on COVID-19 response and then open it up for question and answer. Kevin, if you're ready, please go ahead.
Yes, thank you, Scott, and thank you all for joining us today and continuing to work with us to provide important information for our community. I want to begin with a little overview on our COVID-19 vaccination efforts. We're continuing to make good progress to dispense the vaccine to both essential workers and seniors that are 70 and older. The state just released their numbers as of yesterday for vaccines administered in Washoe County. That's in their database. I believe these numbers are still lagging a little bit with the data entry that happens on the back end of the shots being administered. But we now have over 75,000 vaccines administered in Washoe County that the state is reporting. And that's up approximately 16,600 people vaccinated since their report update last Wednesday. The rate per 100,000 population, which is also equal to the percentage of people in Washoe County vaccinated, is it's 15,737 is the rate. So the percentage 15.737% of our population vaccinated, and that is comes to 11.164% of the population that received their first dose. That's up 1.92% over the week, and 4.57 of the percent of the population has received the second dose, and that's up 2.53%. So we're making good progress here at the health district. We've administered over 30,000 vaccinations to date, and over 10,000 of those individuals are fully vaccinated. And we're working, continuing to work with our frontline essential workforce to expand that beyond our teachers, childcare, and higher education frontline staff to include the essential workforce frontline workers that are working in organizations that support the needy, the homeless population needing shelter, the elderly, people with disabilities. We've I should add on Friday last week, we had a record number that we sent through our pod. We exceeded 1,800 people that were vaccinated in one day. So we continue to, between the health district and other partners, have additional capacity to administer the vaccine in Washoe County. And our limitation is the supply of the vaccine that's being provided to us. However, we are seeing an increase in that vaccine that's being provided to the county, so we hope to see that continue to increase. We've sent email invitations to over 4,000 seniors that are 70 and older to get vaccinated. So we're working to fill our schedule next week with more seniors in addition to the essential frontline workforce. And I just want to make an appeal to everyone in our community to help seniors that they know, whether they're friends, neighbors, relatives, to ensure that they're getting the vaccine when they have the opportunity. So if you know of somebody that's 70 and older, and even 65 and older as far as getting on our waiting list, if you can connect with them, talk with them, find out if they have been able to get vaccinated, if they haven't, if you're able to help them. We know that we have seniors in our community that are receiving emails or calls from us and are confused, or they're having difficulty navigating the system to get even signed up on lists or registered. So we need everybody to help out if you can with helping the seniors that you know to navigate the system, and you may have some more computer savvy skills that could really help them out or just provide them with some guidance and advice. If seniors have received the email that we have sent out to those 4,000 people, they also need to understand that once they receive the email, they still need to go to the link on the email and schedule it and answer some basic questions to be scheduled to get the vaccine. So we have had problems with seniors that receive an email inviting them to go to get scheduled for the vaccine, and they show up just because they got the email and or they're not in our scheduling system, and we're not able to get them vaccinated because they didn't go through that process. So any help that you can provide to seniors that you know in the community would be greatly appreciated. As far as our COVID-19 situation with transmission that's occurring, I think everybody has heard about the different variants that have been identified. And the UK variant, the B117, has been identified in Las Vegas and Clark County, as well as in California. And we believe that it's highly likely that we have the B117 variant here in Washoe County, although we have not yet had a laboratory confirmed specimen that's been identified as that UK variant. But we have been notified by 2 counties in California that have had that variant cases that have had a travel history in Washoe County. And so between our close connections that we have with Clark County, as well as people that may have traveled here and have that variant, we believe it's quite likely that we have that here. And so people should be aware of that and remain very vigilant in their practicing the wearing a mask, washing their distance, and washing their hands to avoid potential spread of that disease. I also want to remind everybody that we do have free testing for COVID-19 that we continue to provide through our post operations at the Reno Livestock Event Center. And so if anybody needs to be tested, wants to be tested, they don't have to be exhibiting symptoms. They can do that by going to the website and getting scheduled there. And as a reminder, we also have the call center line available for people that don't feel comfortable going through the website process, and that is at 328-2427. The COVID-19 cases in our community, the new case numbers continue to trend downward. We've been under 100 new cases per day on the 7-day moving average since February 4th. And as of yesterday, our 7-day moving average was at 87. So it's encouraging to see that number going down, as well as the decrease in the active cases that we're seeing in the community. Remarkably, we had just 13 new cases yesterday, which is, I think, the lowest number of cases that we've had going back to last June. We're also seeing our positivity rate from our testing continuing to decline, and under the state's county tracking system, that is at 11% positivity today, down from a high that we had of around 22% positivity earlier in our surge. So while our demand for testing has decreased, seeing that positivity number come down in spite of a reduced number of people getting tested is quite encouraging. However, we do remain flagged under the county tracking system for both the number of new cases that are occurring and the positivity rate that we have. So we really need people to continue to do the great work that they've been doing together as a community to do their part in practicing the precautions and helping to reduce the spread of the transmission. And I think what we're seeing as well is that the pause measures that the governor has instituted have been very effective in conjunction with that cooperation from our community members in reducing the number of cases that are occurring. We need to try to continue with that trend to get down to as a low level as possible. So with that, I think I've covered my points. I'd be happy to take any questions, Scott.
All right, thank you, Kevin. If anybody has a question, please feel free to speak up. If you want, you can also leave it in the chat box and I'll read it out loud. Please go ahead.
Kevin, Frank Mullen with the News and Review. In Las Vegas, they are finding that UK variant in really a handful of people, but also they've been checking the sewage there, which leads them to believe that there are probably thousands and thousands of cases they don't know about. Are they doing any of that sewage checking up here in Washoe County?
The university has been doing some studies, Frank, with wastewater sampling and looking at levels of the virus that they're finding from analyzing those samples. But I don't believe that we have had any of the genomic sequencing testing occurring from any of that sewer sampling here in Washoe County today. So we don't have any information from the wastewater studies on the variants here.
Thanks.
Hey, Kevin, it's Kenzie with News 4. We keep seeing those active cases drop and those recoveries increase quite a lot. Are you guys all caught up on the recoveries, or is there still a little bit of a backlog there?
Well, I think we're trying to keep up as best we can, but I can't tell you that we're completely caught up on the recoveries, but I think we're probably getting pretty close, Kenzie. We don't have a statistic for what we're missing, but we're getting closer and closer. And with the reduction of cases that we have coming in on a daily basis, that's helping with some of that workload on the data management side of this, but also coming off the peak that we had with the huge numbers of cases that were occurring. We're now having high numbers of people that are recovering as a result of that time period that's passed. And so just the large number of recoveries versus the new cases that we have is what's really driving the reduction in those numbers.
So yesterday's 13 cases was a true indication of the downward trend and not some error in the reporting or anything like that, or a backlog at the lab?
Well, it's the reason we do the 7-day moving average is that from day to day you can have quite a bit of variation, but we're seeing a consistent trend in that 7 days. So I think that 13 cases in a day is abnormally low versus the 7-day moving average of 87 that we have, but it's certainly within the types of variation that we can see happen from day to day.
Hey, Kevin, Brian Hoffman with 2 News. Just wanted to absolutely confirm, we haven't seen any cases of either variant here in Washoe County quite yet, have we? Any confirmed cases?
Referring to the UK and the South African variant, Brian, yes, is that? Yeah, we have none confirmed at this point.
Are you able to clarify which 2 California counties said that they had travel within Washoe County with that UK variant?
The notification that we had was from Yolo County, and I believe the other one was Alameda County. But I'll have Scott work on posting something to make that clear.
Hey, Kevin, this is Lucia Starbuck from KUNR. I have a quick question. I think you guys have given us this number before, but I just wanted to make sure. If you guys had like unlimited doses of the vaccine, how many could you do in one day at your guys' pod?
Well, we've been able to do 1,800 in a 6-hour period. So our rate at the pod that we're able to dispense at is about 300 doses an hour. And so it's scalable depending on how many hours we would be operating. But certainly we can progress at 1,800 a day that we dispense at our pod. And I believe that Renown's pod is able to operate at about 1,000 per day. So that's 2,800 per day right there. Community Health Alliance, they have a capacity for first doses at 240 per day. We have the 12 pharmacies that are also dispensing. So I think we have some significant capacity ahead of us.
Thank you. And I'm just curious, what are your thoughts on the 2-lane system? Is that working out for you guys? Is there anything you do differently?
You know, I think that there's no perfect approach, but I think what we have with the state is a good approach. And I think it's important that we provide a balance between essential workers that we need to continue to deliver services that are frontline and are directly exposed and at risk of not being able to continue to provide those services if they do acquire COVID-19, and balancing that with the needs of the general population that we know are at higher risk. So I believe we've had over 60% of our fatalities have occurred in that 70 and older age group. So it's important that we have a balance between making sure that population gets the life-saving vaccine that they desperately need, while we're also continuing to make sure that we have people vaccinated to be able to provide those very essential services direct to all our community.
Thank you.
Hi, Kevin. It's Siobhan from the RGJ. Of the 9,000 invitations you sent out to the school district for spots, or how many you did, I know they did some through their own pods. Do you have a percentage of how many of those did show up for vaccines?
I do not have a percentage of how many have shown up for their vaccines. I believe, if I heard correctly, the school board meeting last night, that they said that about 80% of their staff were being vaccinated. And we expect to conclude our vaccinations for school district staff this Saturday.
And then with the vaccine, I know it's a question I've asked you and we've asked other people. Is it an appropriate question, or is it too a HIPAA violation to ask somebody if they've had the COVID vaccine, like someone you work with, someone who may be your teacher? Is that an appropriate question, or is it not an appropriate question?
I think it's a question that an employer could ask based on needing to understand the status and how they may want to manage their workforce moving forward. I think it's a medically private information. So the individual, if you ask a coworker whether they've been vaccinated or not, they don't have an obligation to tell you that, to answer that question. But
employers, you think, could ask that question as their
I believe employers could have a justification, but I'm not a lawyer, and
right.
Yeah, so don't take mine as legal advice.
Right. Is it a question you think that's fair to ask employees, though? Is it something you want to know of your staff?
Yes, we are tracking our staff that are vaccinated.
Okay, thanks.
Hey, Kevin, Brian Hoffman again with 2 News. I did a story the other day with the mortuary services who were still a little troubled that they haven't gotten the vaccine yet, and that they were on a lower tier than the healthcare workers, thinking that they would be in the same tier based on previous practices and exercises. And after doing a little bit of research, Clark County mortuary services have had their vaccine, or at least in the current tier. About how soon are the mortuary services here in Washoe County going to be getting those vaccines? And is there any consideration on moving them up, since they do deal with decedents that have recently passed from COVID-19, as well as family members who are at greater risk of actually having that virus?
The mortuary workers are in the frontline community support. And so we do have a number of classifications that of different essential workers that we'll be moving through before we get to them. And you can see that information on the COVID-19 Washoe vaccine website. So after we move beyond the group that I just mentioned that are providing the services to homeless, elderly, and people with disabilities, then we have veterinarians and veterinary services that provide care for service animals and support animals. We've got some of the front-facing state staff and frontline legal services, continuity of governance, our essential public transportation workers, the remaining essential public health workforce, and mortuary services. And I would add that I think just about any or many groups can make a compelling argument for why they should be next to get vaccinated. But we are going with the playbook that the state has put together. That's what we're required to do. And I'm aware that things were done differently in Southern Nevada, and there were some significant deviations from the playbook that occurred there, which has caused these questions to be asked of, why is it that down in Clark County, these people were able to vaccinate it and not here? And I believe that's why the governor made his comments the other day and stated that they were paying particular attention to what was occurring in Southern Nevada.
Thank you.
Hi, Kevin. Terrell Wilkins from the RJJ here. I actually wanted to ask you about those comments on Friday. I know that Governor Sisolak was basically saying that a lot of the zip codes in especially Clark County that experience the highest number of COVID cases are the same zip codes that experience like the lowest frequency of vaccinations. And I was just kind of curious about here in Washoe County, what sort of steps do we take to here to sort of maintain that vaccine equity within the two-lane system that we have currently?
That's a great question, Terrell. And we're actually looking at the wait list that we have assembled of the 70 and older population. And we have the ability to pull by zip code number as well with that list, so that we can make sure that we have people that are being selected out of some of our highest need zip code areas in order to be vaccinated. So we're working to approach it that way. And we're waiting on updated demographic data from the state, but we're also looking to that to monitor how we're doing and assess if we need to do more with that zip code selection process.
Gotcha. And have you seen, just as a follow-up, have you seen any examples of people jumping in front of frontline healthcare workers or education workers or anything in the two lanes that we have so far? Or any examples of, like I guess I just said people, I guess getting it ahead of schedule? Yeah.
So we did have a report in the Reno Gazette Journal that highlighted a case that I think people were aware of already, where a mistake was made in regard to having some of the court staff vaccinated, Reno Judicial Court. But for the most part, I think that we've done a good job here with the compliance. We've worked hard with the partners in fire, EMS that have been dispensing, that we've been working with, and our healthcare providers to try to keep everybody on that same track. That said, it's also very important that we don't waste any doses. And so when a vial has been punctured and there are doses remaining in it, and the people that were scheduled to be vaccinated have all been vaccinated, it's important that those remaining doses go in somebody's arm versus having it get wasted. And so in those instances, if there are people that can be accessed readily in order to make sure that those shots are dispensed, we want that to occur, and that will likely result in some cases in some people that are a little out of order because of that circumstance. But that should be a small number of people.
Kevin, are you guys seeing an increase in vaccine allocations? It doesn't sound like staffing's the problem anymore. It's just a matter of how many vaccines you're receiving per week.
That's correct, Kenzie, and we are seeing an increase. I think we had about 2,000 more doses between first and second doses that we received this week, and so I hope that increase will continue.
Hey, Kevin, this is Jason from the Reno Gazette-Journal. Speaking of supply as well, like I know when I was talking to one of the community organizers, they said one of the challenges as far as doing more vaccine clinics in these underserved areas is the lack of vaccine supply. Are you saying is that a continuing issue? And do you have an idea in terms of when you think you might be able to scale up vaccination clinics in some of these underserved areas?
So Jason, that's correct. It is the supply that's the issue. And I'm afraid I don't have information to be able to say when we're going to see it increase and how much we're going to see it increase, or dependent on what is provided to us from the federal government, and based on the speed at which it can be manufactured by the two currently available vaccines, the Pfizer and the Moderna. So we're told that they're working to increase production, and that we expect to have some increase in supply coming forward, but I don't have any solid numbers to be able to provide on that.
Is there a certain number of supply that you can get that would make you like say, okay, this is a good number, we can start doing more clinics like elsewhere?
Well, we're doing more clinics as we have more supply become available already through the health district, but I think we've got we're going to need significantly more supply to really be opening it up to a number of additional providers. But we are talking with fire agencies as well as Community Health Alliance, our federally qualified healthcare center, regarding some approaches to doing additional clinics in the community as the vaccine becomes available.
With so many more people getting the vaccine, this is Brian again. Can you talk to us about the importance of still wearing the mask and still social distancing, even if you do receive the vaccine, and that, if you can or can't still pass on the virus, even if you do have it, or have the vaccine, that is?
Yeah, thank you, Brian. That's an important reminder for everybody in our community, is that you still need to continue to wear a mask and practice those social distancing practices even after you have received your vaccine, because of the potential that you could still transmit the virus even though you've been vaccinated. And I've also commented before, with the continuing high level of cases that we have in the community, while it's down from our peak, we still have many, many more cases than we'd like to have. There's a lot of opportunity still for you to be exposed to people that are contagious and could cause you to get COVID-19. So it's likely that each individual who's vaccinated wouldn't get COVID-19 because it's 95% efficacy. But that doesn't mean that everybody that's vaccinated is not going to get COVID-19 if they're exposed. So you should do it to not only protect others from being infected in case you are transmitting the virus, even though you're not getting sick from it, but also to protect yourself from the potential that you're near somebody with COVID-19 and you still could potentially get sick from them.
Thanks, Kevin.
Any other questions for Kevin? Okay, thank you all for being here. Thank you, Kevin, for the update. This, as always, this recording will be on the COVID19washoe.com website. And I also encourage you to go to our COVID19washoevaccine.com website for all the latest on the vaccine in Washoe County. Other than that, we'll see you next time. Thank you.
Thank you.